Hello, I'm Dr. Linda White-Ryan, and I'm the Assistant Dean at the Westchester campus here at GSS. I'm also responsible for preparing all of the students for the LMSW licensing exam. The way we will approach it is that this module will be Module 1, and it's on test-taking strategies. So today, what I would like to share with you are some of the best practices of approaching the licensing exam. This is an exam that it's not that they are out to trick you, but there are certain strategies that can help you pass the exam and be successful, which I know that everyone who is viewing this video right now will be. So let's get started. So what's the purpose of licensing? Why should we need to have a license in the first place? Many years ago, or not that many years ago actually, social workers were certified. But if you stop to think about it, why should we not as social workers be licensed? Almost all healthcare professionals are licensed. Physicians, nurses, occupational therapists, physical therapists. And so it's important for us to have our place at the table as licensed professionals. And so the purpose is to really ensure and evaluate your level of competency, that you have basic competency to practice the profession of social work. And what does it do? Well, this exam and getting licensed actually protects the citizens that you will be working with. So it really, from misconduct and also from malpractice, and it demonstrates that you are professional. And so the accredited and associated governing bodies for the profession of social work are Social Work Regulatory Boards, ASWB, Association of Social Work Boards, and the Council, CSWE, the Council on Social Work Education. The other things that determine an authentic profession, which social work is to have your own, for the profession to have its own body of research conducted by members of the profession, such as in social work. And we have that. I'm also very happy to say that the Social Work Code of Ethics is the most extensive code of ethics of all the healthcare professions. So we have all of those aspects that make us an authentic profession, which is really important. So let's talk for a moment about the licensing exam itself. So the exam is made up by the Association of Social Work Boards, ASWB, and it develops the exams for New Jersey, New York, Connecticut, but also for all of the other states. The only state that did not take this exam developed by ASWB was California, and as of last September, they came on board. So it's really the same across all states. So what I want you to remember is that when you're answering questions, I always say to students that you want to remember that a student taking this exam in Idaho or Kansas is taking the same exact exam that you are. It is across all of the states. There are, in fact, about 22 versions of the exam, and of course, you never know which version you will get. So let's go on. Let's talk for a moment about the structure. The structure of the exam is as follows. The length is 4 hours. So you have 4 hours to complete the exam. Should you need to go to the restroom, and please, if you do need to go to the restroom, go. But the clock keeps ticking. I'll address that a little bit later. So if you take a few moments to go out and go to the restroom, splash some water on your face, gather yourself a little bit, the clock will keep ticking. However, you should be able to successfully complete the entire exam in 4 hours or less. That's what students report. Okay, there are 170 questions on the exam. 150 are scored. The remaining 20 questions are pre-test questions that are being evaluated for use in future tests. but you won't know. So as I will say in a down the line in a few minutes, please make sure to answer every question. You never know which question is going to be one of the pre-test questions that will not be actually counted in your score. The good news and the bad news, as I said in the video that I made on how to apply for licensing, is that you will find out the day you take the exam if you have passed. So that when you are done with the exam, it's a little bit like Jeopardy. They'll say, is this your final answer? And there'll be a submit button. Make sure you go through and check that you've answered every question. And then once you push the submit button, it'll take about 60 seconds or a little bit more, very long 60 seconds, and then there'll be a pop-up that will say, congratulations, you have just successfully passed the licensing exam. It will not tell you your percentage. I had a student call the other day to ask about, well, someone told me the percentage. It will not give you a percentage. It's going to give you the number of questions you needed to get correct, that you answered correctly, and the number you needed in order to pass. So you will be able to gauge it in that way. We'll talk about that a little bit more in a few minutes. Okay, so these are some resources for studying, because this is an exam. No matter if you were the best student that ever came through Fordham University, you have a straight 4.0, and I know many of you do. We have many, many great gifted students here. However, you still need to study for this exam. And so some of the resources that I think are useful, and I'm not recommending, but I'm telling you what I think is useful, are social work examination services, and their email address is www.swes.net. And what you're going to do is click on the home study program. You want the master's level guide, not the clinical. That's for later on if you want the LCSW, but the master's level. And there's a lot of, it's pretty comprehensive. There's a lot of material on each content area and several practice exams, full exams that you can take that will tell you if you got the answer correct and why not. So it gives you the rationales for your answers. You can also buy for an additional fee a computerized exam on through SWES. So that is your choice, and students report this being a very valuable resource. An additional study material that I think is really helpful, students report it as being helpful, and it's actually the woman works for ASWB, and it's called the Master's Exam Guide, A Comprehensive Study for Success. The author is a Fordham graduate. Her name is Dawn Apgar, and you can order it directly from the publisher, from Amazon. There's the ISBN number, there's a phone number, so you can do it online, or you can call directly to the publisher and buy the book. Okay, there's a full set of practice questions at the end. It's quite comprehensive with the rationales. However, there's no computerized study materials involved in this. Another is AATBS, and this is Association for Advanced Training in the Behavioral Sciences. Fordham students get a 15% discount if they buy these materials. There are study manuals involved that have practice questions. You can also buy computerized practice exams for a fee. I didn't put any of the fees in any of the study material resources because they change. And so I didn't want to tell you it would be a certain price and then you go to buy it and it's different. So that, I think, the practice exams can be very, very helpful. And again, there's the contact information for these resources. One that I do recommend is ASWB. Once you get approval from the state, the Office of the Professions, for the state that you want to be licensed in, where you'll be taking your exam, you can then buy, and once you then contact ASWB and you actually set up a time a date to take the exam, You are welcome to buy a 4-hour practice exam for $85, but you can't buy it until you're only 30 days away from the exam. I mean, you can buy it, but it's only open to you for 30 days. In other words, you buy it and it stays open on your computer for 30 days. So I always say the closer you get to the exam, the better. It is an excellent, it's $85, which I know is a lot, and you've already spent a lot of money here at Fordham, but it is very similar to you can only buy it one time, it's one exam, but students report that it helps them get ready. Why? It's 4 hours in length, and so you can sit down and take the full exam so that you start to be able to time yourself. So when you're prepared and you walk into that exam, you've already done practice exams and you're ready to go. You know, you're familiar with the process. And so I recommend that because students say how helpful it was. You can also buy a study guide for less money. It has good information on test-taking strategies, but no content. What I am doing in the whole online licensing preparation course is I'm doing 1 module for you on test-taking strategies and then 4 on content, the different content areas. Should you want to take practice questions, because I, for the most part, will not be covering that, you can purchase the practice questions from the different resources that I've mentioned. So let's look at the examination content. As I mentioned, there are 4 areas. So human development and behavior in the environment, 28%. It covers theories and models, concepts of abuse and neglect, diversity, social, economic justice, and oppression. Assessment, diagnosis, and treatment planning, 24%. Direct and indirect practice, 21%. And professional relationships, values, and ethics, 27%. However, although there are 4 distinct areas, I want to be clear. One question might cover a few of the different areas. They are looking, the examination is looking to make sure that you can competently answer questions showing that you know how to apply what you've learned. The knowledge you've gained here at Fordham, they want to make sure that you can apply it in practice situations. So a lot of it is about application, and we'll continue to talk about that. So what are some of the most helpful strategies? Well, you want to give yourself some time. I know everyone is in a rush to take the exam, and I certainly understand it. You want to be able to get a job, and licensing in this day and age is very, very important. When I began in this position as assistant dean 8 years ago, students could get a job and tell their employer, well, I'm going to take it in a year or 2. They had their MSW, and that was good enough. Now, most agencies want you to be licensed, and so you want to take the exam in a timely fashion. However, you also want to give yourself enough time that you can prepare. So how do you do that? Well, you're going to review your class notes, certainly, and other preparation materials that I've outlined, study materials. You want to think about what you learned in classes and try to integrate a lot of that information, but you really have to study in advance before you take this exam. And this module is about strategies for how you approach answering the test questions. So you want to get organized. That's really important. You know yourself best. I always say to students that the greatest guru there is the one that lives inside of you. You each know how you study best. Some of you study best in a group, some on your own, some at night, some in the morning. Whatever it is, get organized, develop a plan and a schedule so that for this month or this 2 months, I will spend this amount of time studying 5 times a week, or every day, or 4 times a week. Whatever it is that you need to get ready for this exam. You might meet with a study group. So some students say to me, well, Dr. White-Ryan, I really don't do well in a group. You could meet with a group for support and answering questions, but you could do most of the studying on your own. or you don't have to meet with a group. Whatever, you know yourself, so access that inner knowing and utilize it. Take multiple practice exams on the computer. Practice makes perfect. So the campuses have, we have laptops, we have computers in the school, or you can buy the study materials I've mentioned. When I talked to all of you in the how you apply for licensing, I mentioned how you go about borrowing the laptop computers or utilizing the computers that are in the different schools. So you can go back to that, look it up, and access that. And student services on our campuses will be happy to answer any of those questions as well. But multiple practice exams do a number of things. They get you used to the way the questions are asked. They really help you with your timing, which is so critically important. And they decrease your level of anxiety, because when you walk into the room and you sit down at that computer, I'm ready to go because you've practiced. So practice makes perfect. So think about that. So the exam itself, Bloom's taxonomy of cognitive processing is used for scoring the exam. They use raw scores. So remember I said you won't get a percentage. So it used to be 75% in one state was passing, 80% in another state. Now they use Bloom's taxonomy. And so it goes by, and I'll go over this again, it goes by the number that you get correct, that you need a certain number of correct questions in order to pass the exam. And they will tell you, you will know how many questions you answered correctly. And the questions are really based, for the most part, on the following cognitive processes. Recall, previously learned material in either your classes, your integrative seminar, or when you were preparing for the exam. And it will be direct recall. You will remember it. It's more of a memorization. But there are very few questions like that. Comprehension, knowledge of material. So you will have to have the knowledge. And application, the ability to use and apply the knowledge you have gained, is really very important. For some reason I said gained by. I shouldn't have said that, so please just ignore that. I apologize. On most of the questions, you will not be asked to solve a problem, but about what to do first or what not to do as a social worker in that situation. Generally, you'll need to get between 93 and 106 answers correct of the 150 scored items. As I mentioned earlier, there are 22 versions of the exam. Some are more difficult than others. It's the luck of the draw. And so if you needed to get closer to 93 questions correct, then you had a harder combination of questions. And if you needed to get 106 correct, that means that particular version of the exam was considered to be, whether it was or not, I don't know, but considered to be a little bit easier. So just so you have an idea, but you have to keep that number in mind. However, don't obsess on that. Just prepare yourself and you will be fine. The types of questions, as I said, direct knowledge, applying knowledge in the form of a short vignette, and applying knowledge in the form of a longer vignette. You will have both types, short vignettes and longer vignettes. A lot of the students report that shorter vignettes are seen more on the LMSW exam, with a lot more longer questions on the LCSW exam. So here's an example of a direct recall question. Example of a direct recall question is, alcohol is A, a hallucinogen, B, a stimulant, C, a depressant, or D, a hypnotic. So the answer is depressant. Alcohol is a central nervous system depressant. I'm sure you learned that along the way in your coursework, but that's something you would need to know. There are not as many questions like this on the exam, but that's an example of one. Knowledge. So here's an example of a knowledge question. In setting goals, it is most important to establish goals that are A, agreed upon by the client and social worker, B, compatible with the social worker's area of expertise, C, appropriate to address the client's presenting problem, and D, short-term and easily attainable. Read the question carefully. What we're looking for are keywords and items. Ask what is the most. So in this question, they're asking what the most important thing to establish goals are. And so if you look at the questions, A could be correct, B not so much compatible with the social work's area of expertise, C appropriate to address the client's presenting problem, and D short-term and easily obtainable. So C could be correct, D maybe, but the answer is A. And the reason the answer is A, a lot of times students will say, well, you know, really the presenting problem is very important. Absolutely, and it should be appropriate to address the presenting problem. However, there needs to be collaboration between the social worker and the client. As we know, we in the field of social work, we don't fix clients. We're not pathology based. We collaborate with clients, so that you would need to have an agreement between the client and the social worker first. Okay, so that's another example. Here's a short case vignette, okay, which is application of knowledge. An example is the family of an unemployed worker is experiencing stressful family relationships as a result of financial problems. Initially, the family will benefit most from information provided by the social worker about family counseling, financial services, job opportunities, or vocational rehabilitation. Now, all of these could benefit this family. All of these, but what would be most important would be information about financial services or financial entitlements, financial information that could help this family that has a financial problem, whatever that may be. But family counseling is important, they're all important, but you're looking what is most important. So you're always looking for the best answer. It might not necessarily be the answer that you can consider to be the right answer or the correct answer, but you're looking for what is the best answer. And you take the keyword, you take what they're looking for. In this case, the keyword is most, and you focus on that. Okay, here's an example of a longer case vignette. Rudy, age 14, comes from a family residing in a community that has a problem with drugs and alcohol. Rudy has one brother and one sister, and they are both experiencing problems with alcohol. Rudy's father suffered from alcohol addiction and died from cirrhosis of the liver 1 year ago. Rudy has always been a good student, but just recently began having some problems in school. As a social worker conducting the assessment, you will need to consider which of the following first. So remember that the keyword is first. That's what would you do first? Encourage Rudy to do better in school? Well, of course we would want him to do better in school. Find a way to help the entire family deal with their substance abuse issue. Focus on helping the mother address the school problems. Or D, assist Rudy to understand the family cycle of abuse and refer for services to help him take another path. All of them could be ways to help. However, Rudy is the client, not the family, and the mom is not your client. Now, you could involve mom in treatment, but the answer is D. Assisting Rudy to understand the family cycle and what's happening in the family system. All families are a system, so helping Rudy understand that and then referring him for services that could really help him to, as the question says, take another path. that he does not have to have the same experiences that his siblings and his father had. So that is the answer, and that's an example of a longer vignette. So let's talk about the format and the structure of the exam. The question format will be, the answers will be, there'll be a question, and the answers will be A, B, C, and D. You'll never see on this exam, on either the LMSW or the LCSW, choices such as none of the above or A and B. I know that in some of the tests that you've seen here in your exams, you might have that as one of the choices for an answer. You will not see any of that. And it will never say, name two. It will be A, B, C, or D, and you pick one of the multiple choice answers. There also, just make note, and I will be mentioning as we go along in content review, some of the names of theorists, but for the most part, you will not always see the names, or, will the names of certain theorists be included. Every now and then, Erik Erikson, and Abraham Maslow, you will see, and sometimes Freud and one or two others. But as a general rule, there are very few names of important people used because this test is more concepts focused. Okay, so strategies. The majority of the questions will use keywords and qualifiers. So that's what you're always going to be looking for. And some of the most frequently used ones are most likely, most commonly, most important, most appropriate, least likely, least important, except, not, never, should, best, first, next. That's just an example of the most frequently used ones. So right away when you read the question, you're going to look for the key words. That's critical to your approach to answering the question. So, some of the other strategies, always, 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 and I can't stress this enough, the principles that you've learned rather, here in social work, you want to keep those in mind, and we'll talk about those as we go along, when you're answering the questions, okay? So, and you also want to acknowledge the client or the family. Let the client know you hear what she is saying or feeling and provide an empathetic response. And we know what empathy is. Empathy is the ability to step into another person's shoes while still keeping your own boundaries and informed critical perspective, but having empathy for what they're going through. And we want to let clients know that that we're feeling empathy, or we provide a response that is empathetic. Always, always, always get the client's perspective first and foremost. That is the most important. Assess the situation prior to providing a referral. We never refer before we conduct an assessment. You always assess first. The same as we never give a diagnosis or come up with a diagnosis or an intervention/treatment plan until we make an assessment, conduct an assessment. It's important to clarify what you think is happening, what you're hearing. You always clarify with the client, the family, the community, the organization, the group. So always clarify, refer if this is outside your expertise or the agency's, because we're bound to follow the mission of our agency that we're working in, organization, hospital, and if we are not able to provide the services, we can then, and we've conducted the assessment, we can refer. And it's always important when we can to try to normalize for clients, to let them know they are not alone. This tends to really help lower levels of fear and anxiety for clients. Some of the other test-taking strategies that are important, and the way you want to think when you're responding to the questions, educate. Number one, empower the client to use his or her own resources. So we know that in social work, and one of the things that really distinguishes us, I think, among other healthcare professions, is that we are empowerment focused. We want to empower our clients, where we utilize the strengths perspective. We know that every client, no matter what the issues, has strengths. And we want to empower the client to use their own inner and outer resources. Advocate. Advocacy is an important part of what we do as social workers. We are agents of change, and we do a lot of advocacy work. And so to advocate for a client, it has to be action-oriented and to really assist the client to initiate action on their own behalf for whatever it is the problem is and what their needs are. Facilitate. Find resources for the client to assist with the identified problems and to solve those problems. And intervention is the fourth. Initiate direct action if the client cannot do it for themselves. So very often in a crisis situation where social workers are definitely more directive. So if a client is in a crisis situation or a family's in a crisis situation, very often their resources, they become more almost paralyzed. And so this is where we need to be, as social workers, more directive to really initiate the actions in order to bring them back to what we call base, to bring them back to a state of balance prior to the crisis happening. Again, I said it earlier, I will say it again. Please never leave a question blank, because you don't know. Maybe you got it right. And you certainly don't know which are the questions that are being scored and which are being thrown out as part of the pretest bank of questions. Flag questions you are not sure of. So there's a little, on the side margin, there's a place where you can just click, and there's a little check mark, and you can go back later on, because what you don't want to do is spend too much time on one question so that you start running out of time, your anxiety level goes up. What you want to do is do the best you can to answer it, spend a few minutes going through the processes that I will outline for you in a moment, but then if you can't come up with the answer, just click on it, or if you want to review it later, you did answer it and you want to review it, just click on it and you can go back to it. So they will give you either a scratch board or paper in the testing site, and I always recommend that students do what my grandmother used to call a dry run, going to the test site ahead of time, so that on the day you're taking the exam, you know where you're going, you've taken your practice exams, it lowers your anxiety, and you are able to just go in and get started with less anxiety. Although, I'm going to be honest, you're still going to have anxiety. So you're going to write down, so they'll give you scrap paper, you're going to write down the keywords to the question on paper when you're having difficulty with a question. If your timing is great, you can write down a lot of the keywords. If you're struggling a little bit with time, you want to at the very least, write down the keywords for questions that are, you're getting stuck on. 80% of the time you can get these questions down to 2 choices. That's wonderful, okay? You can get it down. There's a 50% chance of answering the question correctly when you get it down to 2 choices. That's pretty high. It's better than not answering the question. You may get it correct. And there's a 25% chance of getting it correct with 4 choices. So think about that. Never leave it blank, and try your best to calmly think it through, which we're going to talk about in a moment. So one of the things that you will be doing on this exam is analyzing these questions. And what I mean by analyze is develop the ability, as you're studying and doing practice exams, to break down the questions. You're going to break it down. That's really important. Break down both the questions and the answers. So you're going to break down the question, and then you're going to look at the answers. So you read the question, you look at the answers, you're going to try to break down both. And you're looking for key phrases, key words, they sometimes are referred to as qualifiers, in both the question and the answer. Now, I do not mean to infer that in the answer there's always the same key word as in the question, but there may be phrases, and so you want to make sure you look for that in both. Identify, as I've said, and will continue to say, keywords and qualifiers. And always looking for and recognizing, remember in the beginning I said, your basic social work principles. That's what you're going to fall back on. I want you to remember something about this exam. This is the Licensed Master of Social Work exam. It is not the Licensed Clinical Social Worker exam. So that the difference being, you will be asked, clinical questions for sure, but they're looking for basic competency and that you can apply, that you know the basic social work principles and you apply them in practice situations. Very, very important. So, you read the question and find the keywords and underline them. So underline them on your scratch paper. Remember that the best answer may not always be the correct answer. And students, taking the exam, and myself, even looking at the questions, sometimes I think, that's the wrong answer. And I worked in the field for many years, so I think I know the answer. However, I want to give them what they want, and that's what you want to do. So you're looking for the best answer, not always what you consider to be correct. And the way you find the best answer is you pull apart that question and you look for keywords, qualifiers, in order to determine what they're looking for in the answer. And so you try to identify the qualifier or keywords in the question. Often these words are capitalized like I had here, but not always. Okay, so sometimes they'll be capitalized, sometimes they won't. When you read each of the answers, put the keywords in front of it to make sure that your focus is in the right place. So what do I mean by that? Okay, so you've read the question, all right, and you've looked for your keywords, and you've pulled them out. You can even write them down. And then as you look at each answer and you read it carefully, take those keywords and put them in front of the question as a means of trying to make sure that you're focusing in the right area. Because if it has nothing to do with the keywords or the qualifiers, chances are, not always again, but chances are it's not the right answer, even if you think it's the right answer. So that you want to try to do that. It's a means of trying to make sure you're focusing on the right aspects of the question and the answers particularly. This is important. It's very hard not to do this, but do not add material to the question. Meaning, and I really am going to urge all of you, you just want to stay focused on the question in front of you. Your thoughts may go to a neighbor, a client, a family member that has had this exam situation, or your own life, something that's happened to you. Don't do that. Don't go there, because then what you tend to do, all of us tend to do, is you add something to the question. You want to stay completely focused just on that question. You don't add anything else from your own life, your family's life, your friend's life. Just think of a big red stop sign. Stop if you find yourself doing that. And just stay with the question, all right? Don't add any, and for those of you who have worked in the field for a while, your practice experience will come to mind. Try to just stay with that question. Make sure to note any quotation marks if they are used in a question, or words in the last sentence immediately before the answer section, because in a lot of cases, this is a key to choosing the correct answer. So if something's in quotes, not many questions will have quotes, but if it does, it's important. And also right towards the end, they may summarize in a way or use a phrase that could help you find the right answer, okay, or decide on which answer is correct. So the exam is going to basically present you with questions that require a basic competency, basic understanding of different theories, models, and social work perspectives that are related to practice, okay? So what's a theory? A theory attempts to explain and predict aspects of life. So it explains and predicts. And remember, you know, human behavior in the social environment talks about the lifespan. So different theories, that's what they do. And what's a model? A practice model is the way in which a theory is operationalized. So it may have a theory that it's grounded in, and it's operationalized in the model that's developed, the practice model that's developed. When we think about a perspective, that's much broader. So, for instance, in social work, we really use and consider very important the strengths perspective, that everyone has a strength, or an empowerment perspective to try to empower clients. So those are the things that you want to keep in mind as you approach the exam. Some of the other things, hints that are important is if a question, a short vignette or a longer vignette, includes the age of a person, it usually has importance. They don't put the age in for no good reason. So it's relevant as to how do I choose the answer. So Sophie Jingaleski always says, remember age and stage. So what do I mean about that? So if it's a question about a 2-year-old, what do we know that happens with 2-year-olds? Well, they might be having temper tantrums. That would be considered normal. It's part of that stage of development. If we consider an adolescent, we're sitting with a family and they're telling us about their adolescent. We know that the stage of adolescence can have that need for autonomy. Developing an identity is part of adolescence. And it's very confusing at times to families. Age and stage. Older adulthood. We know that that stage of development very often can include many losses. Age and stage. So that if you see that, pay particular attention to it. And always, 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 I cannot stress this enough, consider the critical importance of culture, race, and ethnicity. It's really important. You must keep it in mind at all times. And so, in regards to age and stage, Dawn Apgar talks about, for example, having an imaginary friend at 4 is very different than having an imaginary friend at 34. So, if a parent tells you my 4-year-old has an imaginary friend, you're like, okay, that's normal. Well, if a 34-year-old tells you he has an imaginary friend, you may be thinking of something else. You will be thinking of something else. So again, that goes back to your age and stage. Also, an important part of getting the right answer is to use the problem-solving process that you were taught from day one here in social work school. And what is that? It involves engagement. That's the first most important thing we do with a client. We engage the skill of engagement. We learn about engagement and the importance of it, and then we apply it in our field internships. And engaging the client is most important, making them feel safe and engagement. Then we assess. We develop a plan in collaboration always with the client. Then interventions. And of course, goal setting is part of that contracting. Then we evaluate our work. We always, always evaluate our work. And then we keep in mind termination if it's longer term work. But even if it's just one session, there's a beginning, a middle, and an end. So it's always important, just remember that in trying to get the right answer, you will think about how do we solve problems? How are we taught to solve problems? So, as I said a few minutes ago, the names of individual theorists are usually not used, or not often used. However, a frequent way in which the client's needs can be prioritized is through Maslow's hierarchy of needs. So we know about Maslow's self-actualization theory. We'll talk about it in Module 2. But Maslow is someone that you want to keep in mind. Not so much Maslow, but his hierarchy of needs, because you have to, on this exam, prioritize the needs of the client. That is first and foremost. And so physical needs come first, then safety, and if your physical needs, food, water, shelter, are not met, it's very hard to go up that chain you need to be safe and you need basic needs met first before you can go to higher level needs. So that when you're answering the questions, you're always thinking physical needs first, safety needs first, and then you go on to the higher level needs. So that's important, and they may or may not use Maslow's name, but you want to remember hierarchy of needs. Always, always, always address health and safety need issues first before dealing with issues related to self-esteem and relationships. That's what I meant when I said higher level needs. Is that important? Absolutely. We want every human being to reach their highest potential of self-actualization. However, health and safety needs first before you go on. So it's very hard to do psychotherapy with someone who doesn't have enough food to eat, doesn't have shelter. So we need to remember this. It's very, very important. So you deal with the basic needs, food, housing, employment, and transportation prior to moving up the hierarchy. Maslow indicates, and he really did a great job with this, that health, safety, and basic concrete needs are the most important. And that's how you will be able to build on that as the client goes up that hierarchy. So, another thing that distinguishes us in the field of social work is that we have a real respect and believe in the client's right to self-determination. That no matter what, even if we think we know best, the client's right to self-determination is our priority. So, answers indicating that a social worker should provide advice to a client because he or she has a better solution to a client's problems are never correct, according to Dawn Apgar. So think about this. If you think you know better, and you're picking that up in the answer, that's not the right answer. So remember that. You're always looking at what is best for the client. The correct answer, and I'll repeat this, the correct answer will always put the client's need first. So that's first and foremost. The only time that self-determination is not considered first and foremost is when it can cause harm to the client or others. That's when we have to look at it from, we don't take the client's right to self-determination into thinking about, we have to think about the well-being of the client or anyone else that he or she may wish to harm. So make sure always that you understand the question completely before you select the answer. That usually means reading it more than once, just to make sure. You may get it like that, that's great, read it again. Give yourself the time. So read the question, identify the qualifying words and quotes if there are quotes, and think about this. What's the knowledge area of concept being asked about? What are they really asking about in this question? Every time you eliminate an answer from the 4 answers, go back and read the question along with the answers that are left. So the ones that you have crossed out and you know you don't want to choose, because in your opinion they're not correct, you want to go back and read the question and the answers again. That gives you the ability to thoroughly understand the question and pick the correct answer. Okay, so we have a lot of words that we use in social work, such as empathy, and believe me, besides active listening, empathy is the most important. But you don't want to just choose an answer because it includes words like empathy or support or strengths perspective. All of those are important to our field of social work. But it doesn't necessarily mean the answer is correct. So what you want to do, use your best critical thinking, meaning think the question through. Identify the key words and phrases and use the process we're discussing here today. Just because you see strengths perspective does not mean it's the right answer, even though it is very important to our profession. So, those are some of the strategies that I think are the most important. Now I would like to tell you how you can get in touch with me. This is my contact information, my name, where I work, and my phone number at my office in Westchester, along with my email at Westchester. You can call me, you can email me. I will get back to you. If you have a question, a thought, a concern, please feel free to get in touch with me. I also have a specific contact, and you're free to use either one. I have a specific contact number and email address just for licensing, but again, I want to emphasize you can use all of the contact information, either or. And so my designated email and phone number for licensing prep is 914-367-3150, and there's the email address. So I hope that some of these strategies will be helpful to you and that you will think about them as you go in to take your exam. The last thing that I will say, besides the dry run and knowing where you're going and taking, if you take 3 practice exams, I think that is sort of a rule of thumb. You should be pretty good to go. But also, I want you to think about techniques such as deep breathing before you go into the exam and even when you're in the exam. So you want to utilize anything you can do to keep yourself as calm and focused as possible. You have come to one of the best schools of social work in the United States and graduated. Every one of you has the ability to be successful in taking this exam. I wish you the best, and I hope these strategies will prove useful to you. Thank you.